Welcome everyone to our virtual paperwork party, part 1 funding overview webinar. My name is Stephanie Moyna. I'm a family support specialist in the Client and Family Integrated Care Department at Holland Bloorview. Welcome to our webinar presentation where we will share an overview of common funding sources as well as changes made to funding due to the COVID-19 pandemic. We will also share general tips and strategies in filling out funding applications. I'm pleased to also introduce you to Payal Khazanchi, who I'm very fortunate to be co-presenting with today. Payal has been a family leader at Holland Bloorview for over 2 years. Family leaders are families and caregivers with lived experience of pediatric rehab. So a lot of family leaders are former clients themselves or have family members or loved ones who have been clients at Holland Bloorview. And they are involved in co-designing, implementing, and evaluating programs and services. Payal has also been trained as a member of our Family as Faculty, who are involved in a wide range of teaching and co-facilitating roles across the hospital. Payal has taken a leadership role in all of the paperwork parties since they started in the summer of 2019. So we're very lucky to have her here today. Feel free to introduce yourself further, Payal.
Good morning, everyone. Thank you, Stephanie, for the warm introduction, and welcome everyone to the virtual paperwork party webinar today. My name is Payal Khazanchi, and in my role as Family as Faculty, I co-facilitate educational workshops and coaching sessions for parents and students. My daughter has been a client of Holland Bloorview for the past 5 years now and receives therapeutic services here. I'm currently serving as the Vice Chair of the Family Advisory Committee, and I'm passionate about advocating for clients and families' needs in improving the quality of care through family engagement in the healthcare system. Handing it back to you now, Steph, for the session.
Thank you, Payal. So in terms of what to expect from virtual paperwork parties, so just to clarify, this webinar is considered part 1 of the paperwork party. So again, it will be an overview of funding sources, updates to funding applications, as well as general tips, tricks, and advice on how to complete applications effectively and efficiently. And we do encourage everyone to sign up for part 2 if that interests you. So part 2 is more of a hands-on workshop. It's a virtual space where families can support each other in completing funding forms. So it gives you a chance to ask staff or family leaders for advice, tips, or strategies when filling out funding forms through small groups in breakout rooms over Zoom. So you can choose which breakout room you want to join. So there might be one for the Ontario Autism Program, one for SSAH, different funding sources. So we're not able to fill out the forms for you, but we're able to provide ideas and guidance on what you can write down. And you can come to as many part 2s as you would like. And of course, listen to the webinar as often as you'd like, as it is a lot of information. In terms of what we'll review today for the funding sources, we're going to look at, so a lot of acronyms here, Special Services at Home, SSAH, Assistance for Children with Severe Disabilities, ACSD, Ontario Autism Program, OAP, Assistive Devices Program, ADP. We'll discuss Holland Bloorview's Family Support Fund, FSF, as well as a few other supports and grants such as Easter Seals, the TTC Assistance Card, and a few more. And then we'll also share general tips on filling out funding applications. So these tips are collected from family leaders, staff, other parents, and certainly insights from Payal herself, who will be sharing this section of the presentation. So it's kind of a curated list of pro tips that we think will be helpful for you no matter which application you're working on. All right, so to get into the funding overview as well as changes to common funding forms due to COVID-19. And just a reminder, we could spend hours talking about any one of these funding sources. I'm going to be going over these pretty quickly, so you can come back to this webinar and rewatch certain sections, and you can certainly sign up for part 2 of the paperwork party. So you can join a smaller breakout room and focus on a particular funding source. Starting with Special Services at Home, SSAH. This funding comes from the provincial government to help families caring for a child with a developmental or physical disability. This funding is not income-based, and it can be used for eligible services under the categories of personal growth and development, as well as family relief and support. As many of you may know, once you apply and are approved for this funding, there is a waiting period and it can be quite long. It's not uncommon for the government to put this program on hold, and it has at times been for a number of years. Having said this, once the funding is released, it is very helpful and can be renewed every year. So we do strongly urge you to make an application and get on the wait list. I know the funds were recently released for many families who had been waiting 2 to 3 years, possibly more, and it is very helpful and worthwhile once the funding comes in. It's also important to make an application because the more people we have on the wait list, the more the government can see how many people are needing the support. So again, SSAH is not based on income, so anyone who has a child with a developmental or physical disability is able to apply. SSAH is an annual lump sum of money that is based on what you've identified as your child's needs, as well as how much support they're already getting in the community. Those are some of the things they look at in the application. This funding also operates as a reimbursement system. So once you receive your funding agreement, the ministry will outline how much funds you're eligible for. Then you can submit your receipts and invoices for things that you've used to purchase. So the family is then reimbursed for what they spent. If spending the money upfront before being reimbursed is a challenge for you, you can try speaking with your worker about this. So when you receive your funding, you'll be told the name and contact information of your special agreements officer. SSAH is primarily used for respite care. This means you can hire someone to look after your child so you can take breaks. And also so that a respite worker can help your child work on their goals, help build up their skills, and really work toward your goals as a family. So that person might be taking your child to the park to have some fun, and also maybe to work on communication skills, social skills, fine motor skills, etc. Hiring a respite worker can mean a professional respite worker. You can find many listings on respiteservices.com, for example, or you can also use the funding to pay a family member or friend to look after your child. You can also use the funding for personal growth and development, including social skills and recreation programs, camps, after-school programs, for example. An important thing to note is that this funding does not cover therapies. So it does not cover therapies such as ABA behavior therapy, occupational therapy, speech therapy, or anything like that is not covered by SSAH. The SSAH application asks you to share how this funding can help with the goals you and your child have, as well as the family's goals. Maybe one of your goals is to be able to spend more time with a sibling, and respite care helps to do that as well. So that's just an example. To be eligible, again, it's not income-based, so you have to be a resident of Ontario and you need medical documentation of your child's disability. The application asks you what are the functional challenges and limitations that your child presents with as well. So in part 2 of our paperwork party, you can join a breakout room specifically for SSAH, and we'll have Holland Bloorview social workers and family leaders available who can help you think of different ways to describe your child's challenges and goals and how this funding would be helpful for your family. Next is Assistance for Children with Severe Disabilities, ACSD. So this is also funding from the provincial government. While SSAH is an annual lump sum of money, ACSD is a monthly allowance. So unlike the last one, this fund is income-based. You can visit the website to find your regional office and phone the ministry to understand the income cutoffs. ACSD funding is a monthly amount given to families who are living on lower incomes. A family can currently receive anywhere from $25 to $500 a month, depending on their income and the child's needs. The funding can be spent on what are considered extraordinary costs related to the child's disability, including clothing, equipment, diapers, transportation costs, and many other things that we can discuss further in part 2 of Paperwork Party. If your application is not accepted for either SSAH or ACSD, or if you believe you're entitled to more than you've been offered, you always have the right to appeal the decision. Later in the presentation, we will share information on getting support from a pro bono lawyer connected to Holland Bloorview, who can help you with the appeal process if you're eligible for that support. So again, ACSD is income-based. So depending on your family income and the costs related to your child's disability, you may be eligible for the higher end of that monthly amount. Passport program. So although Holland Bloorview primarily serves children and youth, we know many in our community are transitioning out of SSAH and ACSD at 18 years old. So we wanted to include some information about passport funding as well. The passport program helps adults 18 years or older with a developmental disability to participate in their communities. It also helps caregivers of an adult with a developmental disability take a break from their caregiving responsibilities. So Developmental Services Ontario manages application processes for all provincially funded developmental services and supports for adults with disabilities. Passport is funded by the Ontario government and administered by local passport agencies. So you can access an electronic version of this presentation and click on all of these links, including a tip sheet for a summary of how passport funding can be spent. So again, it's for adults who are 18 years and older and who need support to participate in the community while they're still in school or have left school and are living on their own with family or independently in a supportive living arrangement. So passport funding can be for services or supports. They can help a young adult take part in community classes or recreational programs, develop work, volunteer, and daily life skills, to hire a support worker, to create their own life plans to reach their goals. This is called person-directed planning, or to get a temporary respite for their caregivers. So those are just some examples. So in terms of changes to SSAH and ACSD due to COVID-19 pandemic, and this list also applies to passport funding as well, as they're all provincially funded. The list of eligible expenses, what you're allowed to spend your funding on, has been expanded due to COVID-19. So in addition to all the existing eligible expenses that we went over, clothing, transportation, equipment, etc., you can now use your funding for goods and services that may make it easier for you to manage staying at home and physically distancing during this time. So new eligible expenses include certain sensory items, technologies, art supplies, fitness equipment, personal protective equipment, PPE, and more. So this change is temporary and only for the duration of the COVID-19 pandemic. There are also opportunities for SSAH and Passport to get some of your funding in advance of processing claims. So you can speak with your special agreements officer about this. Another change, which is quite helpful, is that you can currently submit SSAH and ACSD applications by email and then mail in the hard copy afterwards. If a healthcare provider is helping a family complete the application over the phone, the family needs to provide SSAH or ACSD with confirmation of your consent that someone is helping you. So families can send a separate email consenting for a healthcare provider to help them complete the application over the phone. Another option is the family can provide a copy of our health record consent form. So it's a good idea to call your regional office. All the regional office numbers are listed on the ministry's website to clarify all these COVID-related options and changes if you have any questions or confusions. So in terms of the extra items you're allowed to purchase at this time, so sensory items, items to alleviate anxiety or stress and to support any clinical or behavior plans. So that can include things like a sensory mat, wiggle seat, weighted blanket, beanbag chair, to name a few. Technologies to be able to stay connected online and occupied at home for virtual learning included. So of course, laptop computers, a tablet or a smartphone are all options. There may be limitations to purchasing more than one, so you definitely want to check in with your special agreements officer about that. Arts-based activities, so anything from Play-Doh, puzzles, games, things you can find at an art store like Michael's, supplies for home-based hobbies, as well as fitness activities like skipping rope, yoga mat, resistance bands for indoor fitness activities, or outdoor equipment such as a trampoline or a basketball net. So there are a lot of added opportunities here. Essential service delivery fees. So unfortunately, fees for takeout are not covered, but delivery fees for groceries or medication is covered under the expanded items, as well as behavior support plans and related interventions. So whether that's provided in person or virtually, if you're working with someone to support the development or delivery of strategies to help reduce challenging behaviors or potential crisis situations at home, that's definitely covered as well. So you must save all receipts, invoices, and supporting documentation with proof of payment for all of these expenses. And again, if you have any questions about whether something is eligible or not, it's always a good idea to confirm with your special agreements officer. If the things you need to manage with your child at home during the pandemic exceed what you're receiving in funds from SSAH or ACSD, you can also contact your special agreements officer and ask about the process of renewing your application or applying for an increase. Okay, moving on to the Ontario Autism Program. So OAP is funding from the provincial government available to all children and youth under the age of 18 who have a written diagnosis of autism spectrum disorder. So here's the contact number and email address. If you're at all confused about whether you are registered for the OAP or where you're at in the process, we encourage you to contact them directly. The OAP, in my experience, does not answer their phone line. Their system seems to be that you leave them a voicemail and they will return your call within a few business days. So don't get discouraged if you keep getting voicemail, because you will always get voicemail at the OAP. But they will return your call, and you can always try emailing as well. So if you have an inquiry, I suggest doing both email and phone. Another thing to note is the Ontario government is currently changing the OAP to a needs-based system. So the details of what this will look like have not yet been released. In the meantime, if you have a child with an autism diagnosis, either you've already been registered with the OAP and received a childhood budget, or if you're newer to the OAP, once you have registered, you will receive a letter inviting you to apply for interim one-time funding. So it's considered one time because the idea is that the new system will be in place by the time your one-year funding is complete. So both childhood budgets and interim one-time funding are direct payments of $20,000 if your child is 5 and under, and $5,000 if your child is 6 years or older, which you're allowed to spend on goods or services listed as eligible by the government to support your child. In terms of changes made to the OAP due to the COVID-19 pandemic, the OAP has also extended the deadline to register. So as the government will soon be changing the system to a needs-based system, they had previously announced a deadline of the end of March to submit your registration and supporting documents. However, due to COVID, they've lifted this deadline. So families with new autism diagnoses can still register and apply for interim one-time funding. So that's as of the recording of this webinar as of early December 2020. If you're past that point, you might want to call to inquire, as the ministry will establish a new deadline for this. Another change they've made is that you now have an additional 6 months to spend your childhood budget or interim one-time funding and submit your expense form. So this means you now have up to 18 months in total to spend your funding. So for example, if your original 12 months to spend your funding was to end on June 10th, 2020, you now have until December 10th to spend your funding. So add an extra 6 months. You do not need to contact the ministry to be eligible or to accept this extension. Okay, so we just have a few links to forms here related to the OAP. So we have the registration form if you're new to the OAP. The application for interim one-time funding, which you can apply for once you receive a letter in the mail from the ministry inviting you to apply for interim one-time funding, as well as the list of eligible expenses. So very important to make sure you're aware of what you're allowed to spend the money on and what you're not, as well as the funding expense form where you can track your expenses. If you don't have an electronic copy of this slide presentation for this webinar, to click on these links, you can email resourcecenter@hollandbloorview.ca and ask for the presentation. That email address will be listed on the last slide of this webinar. Okay, other supports. We wanted to make sure you know there are other supports out there to help you navigate and complete these funding applications. So Respite Services is a great organization that has regular workshops, which are happening virtually during the pandemic, to support families in completing SSAH and ACSD. So you can call this number and ask to be connected to their funding workshop. Surrey Place also has video step-by-step guides on completing SSAH and ACSD. And in terms of Ontario Autism Program, the OAP has regular info sessions running through Autism Ontario, where a service navigator can also help you fill out the application and understand how the funding works. And of course, at Holland Bloorview, we have the part 2 of our paperwork parties as well. So for these funding sources, we encourage you to get as much support as possible. Another funding from the provincial government is the Assistive Devices Program, ADP. So this helps people with long-term disabilities pay for customized equipment like wheelchairs and hearing aids and a whole list of other things that's identified on their website. So the ADP also helps cover the cost of specialized supplies, such as those with ostomies and other things listed on their website. ADP covers 75% of the cost for equipment and supplies for these items. And the ADP is billed directly by the supplier. As a result of the COVID-19 outbreak, the ADP is only accepting new applications for funding via email or fax. So they're asking that you please not email applications to the ADP office at this time. However, applications already received by mail were processed. So for the ADP, if you're already receiving grants, you'll continue to do so via regularly scheduled grant payments by direct deposit. For grant recipients who receive payment by check, you may experience some delays. Existing grant recipients who are due for renewal between March 12th and 30th will receive additional funding for 4 months. At this time, ADP will mail renewal letters for you to complete and return. So we do encourage you to contact the ADP directly at adp@ontario.ca if you have any questions. And please note that responses may take longer than usual. In terms of applying for a grant, if you're new to the ADP, the advice is to print the application form, complete the form with the assistance of your healthcare providers, if applicable, and then scan and email them to this email address. They advise you make sure the form is complete, signed, and that all pages are included in your email attachment. And to definitely speak with your healthcare provider or therapist working with your child when you apply for ADP. And in terms of printing forms, you can always contact the Family Resource Center at Holland Bloorview if you don't have a printer and need help getting the hard copy of a form. So we want to let you know again that we do have support from our pro bono lawyer at Holland Bloorview. So her name is Hannah Lee. This is a photo of her here. She can help you with the appeal process if you've received a negative decision on your funding application for ACSD or SSAH or a benefit such as the disability tax credit if you're eligible for her services. So Pro Bono Ontario offers free on-site legal assistance at Holland Bloorview for qualifying clients and families. The on-site lawyer can also help with things related to housing, education, immigration, and employment law, among others. So when you have the presentation, you can click on this link to see if you might benefit from this service. And you can also contact Hannah directly at this email address. In terms of the Family Support Fund at Holland Bloorview, so moving away from government funding, We do have a fund specific to Holland Bloorview. So this fund is on pause for November and December 2020 and will resume January 1st, 2021. So depending when you're watching this webinar, the fund may be paused or open. The Family Support Fund offers financial support to Holland Bloorview families during times of transition or stress. It may support a client's respite needs, equipment, recreation and life skills programs, modifications to home or car, medications, or other medical needs experienced on your journey. So in order to find out what is eligible for January 1st, you would need to get that information first before you submit your application. This fund is inclusive to all income levels, diagnoses, and residential statuses. However, it is limited to Holland Bloorview clients under the age of 19. So to be considered a Holland Bloorview client, you have to have had a clinical appointment with Holland Bloorview within 2 years of the date on the application. So a clinical appointment can mean accessing services at one of our many specialized clinics, occupational therapy, physiotherapy, speech therapy, developmental pediatrician, etc. An additional requirement is that the clinical services access have to be funded by OHIP. So any services that are purchased here are not included. If you have any questions, you can phone Holland Bloorview and ask to speak with someone from the Family Support Fund, or visit the website or contact the Family Resource Center. Easter Seals Ontario is another funding option. Easter Seals provides direct financial assistance to children, youth, and adults up to 19 years with physical disabilities who are registered with Easter Seals to assist with the purchase of specialized mobility equipment and communication devices. So an update in terms of COVID is that they have put a pause on new approvals for equipment funding until they're more confident in their sources of revenue. However, parents are encouraged to continue to send in equipment funding applications as they are optimistic they'll be able to reopen this program later in the year. So you can learn more by visiting their website here. Easter Seals also has an incontinence supplies grant. So they offer funding for children and youth between the ages of 3 and 18 with physical or developmental disabilities who require the use of diapers or incontinence supplies. And in terms of COVID, the grant is still open and accepting new applications at this time. So moving away from funding, this is more of support. Want to make sure you know that the TTC offers a support person assistance card. So this is a photo card that identifies the card holder as a person who, because of disability, needs to be accompanied by a support person or maybe accompanied. So when your child had this card, it means a support person accompanying them is not required to pay a fare on the TTC. So the card will have your child's picture on it, and any adult traveling with them on TTC does not have to pay a fare. To apply or get more information, you can visit their website. Another card you can apply for is an access to entertainment card. So this is for people of all ages and types of disabilities who require assistance of a support person to attend an entertainment venue. So when the card holder presents the access to card at participating movie theaters, for example, or other attractions across the country, such as the aquarium, the Toronto Zoo, Canada's Wonderland, and many, many other attractions, the support person is then given one free admission. So the person with a disability pays the regular admission, but anyone attending with them would get in for free. So there is a small fee for this card. It's $20 for 3 years or $30 for 5 years. And you can apply directly off the website here. Wanted to mention accessible parking permit. A lot of people are not aware that they are eligible for an accessible parking permit. So people with certain health conditions can apply, and if approved, they're able to park in an accessible parking spot. So the permits are issued to a person or a business, not the vehicle. Permit holders must have been in the vehicle and the permit displayed on the dashboard in order to park in an accessible parking space. So you can visit their website to see if you're eligible. In terms of a COVID update, they have extended the expiry date of accessible parking permits for people with disabilities. So you don't need to renew your parking permit at this time, but you might want to check the website for updates about that. Also just want to share that you can access tip sheets on Holland Bloorview's website, including a list of emergency funds to support basic essential needs during this time. So you can find updated information about government emergency response benefits available during the pandemic, as well as other tip sheets. So we have emergency funding tip sheet and a number of other tip sheets that might be helpful to you during this time. We also have a far more extensive guide of different funding issues. So in this presentation, we've highlighted a few of the more common funding sources, but there are many, many more. So please do check out our funding and financial supports guide, which you can click on this link at the bottom here, or put that into the Holland Bloorview website, and you can find our funding and financial supports guide. Okay, now I will pass this over to you, Payal. Okay, so over to you, Payal.
Thank you, Stephanie. I will now be sharing the tips that are helpful in filling the funding applications with you all. So next slide, please, Steph. First of all, please ensure that the application that you're filling is in the most up-to-date version. Dated application forms may not be accepted by the government agencies and not-for-profit organizations, as new information and updates would have been added. In order to save time and energy, it is best to finish multiple applications and take all the applications to your health practitioner or doctor so that multiple trips to receive doctor signatures can be avoided. In my experience, once you have the medical diagnosis, the doctors are fairly quick in signing and sending back the application forms to you for submission. It is your responsibility to collect the forms from the doctor and submit it to the government or not-for-profit organizations. I have always mailed in all my application, whether it's for SSAH or TTC support person card, but with COVID-19, some of the submission requirements have changed and applications are now accepted through fax and online as well. It would be mentioned in the latest version of the application how to submit to apply for funding. Most of the funding applications will have checklists, and it is always in your best interest to submit all the information that is asked for as supporting documents. This minimizes any delays or concerns from the case managers if the application package is incomplete. Since you are the parent or caregiver requesting funding on your child's behalf, it is essential how you describe your current situation with regards to your child's and family's needs. The case managers reviewing your application and granting funds can only understand your situation if you describe it well. Since all these funding supports and resources are offered to families who have children with special needs, it is necessary to emphasize how such needs are applicable for you or your child's situation and how it differentiates from the average or regular kids of similar age group. Keeping the child's goals in mind, it is helpful to mention the child's and family's needs when completing the application. How the funding will support in the holistic development of your child, or what are the extracurricular activities or therapies you intend to enroll the child in that can support and develop their physical or social or cognitive abilities, and how the support services available can be made most accessible to them. Next slide, please. When you explain your family situation in the application, think about the most difficult day that you and your family have had to encounter. That captures your whole situation and how you managed it with respect to your child's needs. Letting the case managers understand about your present family and life situations assist them in realizing your challenges better. Important factors such as other children in the family, aging parents, in-laws, single parent, community support, employment status, all help the case managers know your requirements that influence your daily routine in providing the best care to your child and family. Sharing these details would be beneficial in receiving funding for most of your needs. Next slide, please, Steph. It is important that you state clearly the needs and concerns of the family and explain the reasons why you need the funding in the application. It is important to emphasize and detail your family's current situation and how the additional funding will help in making your child's life better. There is not much space available on some of the funding forms to fill in a very elaborate explanation, but I have always found it beneficial to type in the details on another sheet of paper and attach it with the funding application. This assists in reducing any misconceptions or doubts that the case managers may have in disbursement of funds. None of the case managers or coordinators ever meet with us in person to discuss our challenges and our children's needs prior to dispersing the funds, as all these applications are either mailed or faxed in. Therefore, what we write in the application is what matters the most. There are so many rare diseases and illnesses that the case managers will not have heard of unless we let them know through the information provided to them in the application. So it's vital to share and specify the needs about your child, any medical terminology, or any barriers that you encounter because of the child's diagnosis. You can always reach out to the Family Resource Center at Holland Bloorview for the sample letters for guidance. Next slide, please. The wording and language matters a lot in how you write the details in completing the application. Keywords such as urgent, safety, worries, and emergency help in making the case managers understand your needs and anxieties better. Do not go overboard in stating your challenges, nor understate them. Write how you manage your situation and how funding will assist you in further support and respite. It's important to be as much specific and elaborate your child's and your family's needs, define and detail what is important to you and why the funding is required. Learning about your situation and challenges make the agencies fund your situation based on what you have requested. Avoid using any acronyms or abbreviations as it will only lead to confusion and may delay your application process and funding allotment procedure. Describe and elaborate your situation as much as possible in your application. Next slide, please, Steph. Some of the applications have deadlines and certain timelines. For example, for filling in the ODSP application, it's always suggested to start the application process on the youth's 16th birthday. I had already set an alarm 5 years ago in my phone's calendar to save the date in order to start the process of filing in the ODSP form for my daughter. Always make the copies of your completed application package and keep them safe. These are helpful in case your application gets lost in the mail. I had my SSH application lost in the mail once, and it would have been tiring for me to write in all the details again and put in all the effort. But just because I had made all copies, it was easy for me to send it to the funding agency again. These copies are also helpful in referencing back just in case you receive any review from the funding agency with regards to your family income or change situation. It is helpful to note the date when you mail in or submit your application through fax or online, as that helps you keep track of the timeline that the application may take and when you can expect to hear from them. Usually, it takes 6 to 8 weeks for the agencies to get back to you with approval or additional requests if it's a new application. Next slide, please. Once the application has been sent out, it's helpful to check in by calling the office if the application package was received and the tentative date when you might hear from them. It's okay to follow up with the funding agency regarding the status of your application. Once the funding is approved and X dollar amount is allotted to you for your child and family, it's always in your best interest to check with the officials at the funding agency if any service or program is eligible for funding or not. Next slide, please. So once the funding is given to you, then you manage these funds on behalf of your children. Any service provider who gives you an invoice needs to be first paid in full by the caregiver. Then the receipt received by the caregiver that states paid is to be submitted to the agency. Only then the payment would be made to you. The money comes directly to your bank account through direct deposit within a month of submitting the receipts. Try your best to answer all the questions in the application. Reach out and ask for help in case you do not have any answers. We are here to help. Feel free to come to a part 2 of our virtual paperwork parties to discuss more specifically about your funding applications. And I cannot stress enough on reviewing the application and reading through it again and again before submitting it so that all the details are shared in the application and states the current scenario about your family's and child's challenges. An incomplete application may result in delays, therefore try to submit the whole application in full as a complete package. Next slide, please. Once the funding is allotted to you, you can always send it another application to the funding agencies as and when your situation or needs change. In case the government denies your application or you disagree with the result of your funding application, you have the option to appeal it. I myself appealed to a couple of applications with due reasons, and I was surprised I received extra $100 added to our usual funding. It might not be the case for everyone, but I would suggest that you please do appeal if you disagree with the result of your application. Or if you need more funds for your child's holistic development. You can speak and reach out to Hannah Lee, our pro bono lawyer at Holland Blue View, for more information and answers to your questions. Now, I would hand it over to Stephanie for further discussion.
Thank you, Payal. So this brings us to the end of our webinar. Thank you so much for joining us here. We know that it's a lot of information, so please feel free to review and also to please consider joining our part 2, where there will be a lot of opportunity for asking questions, specific questions to your applications and to your family. So you can find dates for part 2 workshops by going to the Holland Bloor View website and putting virtual paperwork parties into the search. That will be the quickest way to find it. We are holding part 2 workshops monthly, and again, there will be small breakout rooms that you can choose by funding source which room you want to attend. You can also find our wider funding programs guide at the website listed here. And of course, if you have any questions about funding, you should feel free to contact our Family Resource Center at familyresourcecenter@hollandbloorview.ca. Thank you so much, and we hope to see you at a future paperwork party.